Welcome everyone to our online event today, looking at how we are defining kinship care. Emily, if you want to go on to the next one. So this is the first in a series of webinars on kinship care, and this will be usually taking place on the last Wednesday of every month, running until June 2023, and is part of our broader learning series on kinship care. The webinars are happening in parallel with the development of global interagency guidance on kinship care, which are being led by Family for Every Child. Family for Every Child is a global alliance of 45 local civil society organisations in 38 countries. And in 2019, Family for Every Child commissioned a piece of research on kinship care, which showed that this vital form of care and protection for children is widely neglected around the world. This publication, A Paradox of Kinship Care, made a strong case for greater investment in kinship care. We'll share the link in the chat box. And the guidance and webinar series now seek to demonstrate how to effectively support kinship care. If you would like to get involved in the development of the guidance, you can do so by joining the Kinship Care group on the Changemakers for Children platform. We'll also share a link for this in the chat. We will share regular updates and opportunities to input and comments on the guidance. We aim to publish the guidance in July 2023. In this first webinar, we will begin by explaining what kinship care is, the multiple forms it can take, and how the needs of kinship carers differ from the needs of parents and foster carers. We'll begin with a brief presentation and then move into panel discussions. I'd now like to hand over and introduce Emily Delap, who will be co-moderating today from Child Frontiers. Thanks, Emily.
Hi, thank you, Gemma. So I was going to start off with just a brief presentation outlining some of the definitions for kinship care. I'll begin with the definition that's provided in the global guidelines for the alternative care of children, which were welcomed by the UN back in 2009. And this defines kinship care as family-based care with within the child's extended family or with close friends of the family, who are known to the child, whether formal or informal in nature. So formal kinship care, is basically care where children are placed into kinship care by social workers or the courts, whereas informal kinship care are informal arrangements made between family members without any involvements of those formal actors. And you'll see within the definition that it includes care within the extended family, but also with friends of the family. However, we know that in some parts of the world, this second part of kinship care, care with friends of the family, is not included in official definitions. So, for example, in legislation and guidance in Kenya, Ecuador and Cambodia, they only talk about extended family care when they're defining kinship care. In other parts of the world, such as Australia, they have much broader definitions of who is included within the definition of kinship care. And they would include individuals that might have quite loose or tenuous connections with children, such as perhaps a football coach or a neighbour that's willing to take the child in within their definition of kinship care. So as well as kinship care being defined slightly differently in different parts of the world, we have also found through the research we did back in 2019 that lots of different terms are used to describe kinship care. So, for example, in the UK, they talk about care by family and friends. In Laos, they talk about swap care. In the Caribbean, the term child shifting is used. In many contexts, for example, across West Africa, the term child fostering is used, which is a little bit confusing because people get kinship care confused with foster care as a consequence. And anthropologists in several parts of the world use this term child circulation when they're talking about kinship care. So I wanted to touch briefly on a debate that exists around kinship care, which is really about the extent to which kinship care should be seen as something different from other forms of family care, such as parental care. And several authors writing about kinship care have highlighted this risk of othering kinship care, which means kind of viewing it as something that's different or abnormal in comparison to, say, children growing up with their parents. And I liked these few quotes that I presented on the screen. So the first is from a study in Australia, which states that children in kinship care regard their family life as a normal part of the diversity of Australian families. The perception this perception challenges concepts such as placement, access, leaving care, and even kinship care itself as terms that may not be relevant. And this is a quote from a young person who grew up in kinship care. They said, "I never thought it was a form of care. I just thought it was going to stay with Nana or Grandad for this long time, and that's it. It didn't seem weird or strange to me." And there were similar findings from a study in Kisumu County in Kenya, where older carers said that kinship care is so ordinary that they questioned the need to label it as anything different other than just a normal form of care. So I think that recognition that there are some risks associated with othering kinship care and differentiating it from other forms of care needs to be balanced out by a recognition of the kind of unique needs that kinship carers have, which are different from parents. And we're going to come on to those a little bit within this webinar and also in future webinars in this series. So kinship care is complicated. One of the key messages I'd like people to take away from this webinar is there isn't just one form of kinship care. There are multiple different forms of kinship care around the world, and those different forms carry with them different ramifications and risks and benefits for children and their caregivers. So there are really kind of 5 continuums of different forms of kinship care. So the first is from parental care to kinship care. So at one end of this continuum, you have kinship care placements where there is a complete severing of ties from parents. The children don't see the parents, have no contact with them, and they're fully cared for by the kinship carers. And at the other end of the continuum, you have children living with kinship carers, but still regularly seeing their parents or being in touch with them. So there's lots of examples on the literature on migration of parents who may be living in a totally different country, but are still very much involved in the everyday care of their children in kinship care through text messages and phone calls. The second continuum is between formal and informal kinship care. So at one end of this continuum, we'd have children formally placed in care by the state, and at the other end, children who have just been informally placed in kinship care by families. And in the middle, we often see in some contexts religious leaders or community leaders becoming involved in placements in kinship care. So they may help to navigate those placements or formally endorse them, sometimes through ceremonies, but the state, the social services are not involved. The third continuum is around degree of relatedness. And this refers to how close the kinship carer is related to the child in their care. So kinship care often involves very close relatives, grandparents, aunts and uncles and siblings, but it might involve more distant relatives or indeed, as I mentioned earlier, friends of the family. The fourth continuum is around the length and stability of placements. So at one end, we see arrangements that are permanent, and they're quite similar to adoption. The child is living with that family indefinitely. And at the other end of the continuum, we see children, particularly in contexts where kinship care is very common, such as in sub-Saharan Africa, regularly moving between different family members, between their parents and a kinship carer or between kinship carers. And placements in kinship care movement can be anything from the whole length of the child's life to just a few days. So there's lots of variety there as well. And the fifth continuum is around between forced and voluntary arrangements. So at one end, we have cases where kinship carers are being effectively forced to look after children in their care. So we had examples in the research of gang members forcing relatives to take children of imprisoned gang members into their homes, where they had no real choice in this. And at the other end of the continuum, we have caregivers actively reaching out to relatives and requesting children, perhaps because they can't have children themselves, or they're lonely, or they want help around the home. So usually it's somewhere in between this, where kinship carers aren't being forced to take children in, but they might feel a strong sense of cultural or moral obligation to do this. So it's not fully something that they're actively seeking out in their lives. So the form of kinship care has a strong impact on the levels of risk that children face, or the forms of risk that children and kinship carers might face, and therefore on the type of support that you would offer. So, for example, if a child has a high level of parental engagement in kinship care arrangements, this can be great. It can reduce children's feelings of abandonment, and it can ease their eventual reintegration back into the family. But it can also create tensions between the kinship carer and the parent, and disagreement around parenting. And there can also be risks associated with this, for example, if the parents are abusive or if there are drug or alcohol problems. So we need to be aware of this when we're responding to kinship care. In terms of the degree of formality, if children are in formal forms of kinship care that involve social services, it can reduce risk, allowing children in kinship care to be monitored regularly and also giving them access to services. But this can also carry risk. It can, in some cases, deter kinship carers who might not want to be in that kind of formalised relationship. It can also be difficult for birth parents who may feel that this is threatening their rights as parents. And if there is a high degree of obligation on social workers to monitor those formalised placements, it can also really overload the child protection system. In terms of degree of relatedness, the evidence shows that children living with more distant relatives or unrelated kin are more likely to be discriminated against. In contrast, grandparents, children in grandparent care are less likely to be discriminated against, often because there are no other children in the household. And this is often children's preferred choice, and indeed it is by a high degree the most common form of kinship care globally. But children can also face risks within this form of care, and the grandparents themselves can face challenges related to their health, high levels of poverty, and intergenerational relationships. So these different forms of kinship care therefore require different types of support. In relation to degree of stability of placement, the wisdom really is that if children should have permanent stable placements to allow for attachments to form, for continuity of their friendships and schooling, and to reduce their feelings of anxiety and loss if they're constantly shifting. However, we don't really know the impact of frequent placement changes in contexts where regular movement between homes is a normal part of growing up. So we don't know what effect that really has on children and whether that's damaging, and there's quite limited research on that experience from children's perspectives. And we do know that those placement changes can have benefits as well as carry risks. For example, then it can allow children to form new contact and new relationships with different relatives, and these relationships can help them in their adult life, help them to set up and establish themselves. And finally, being forced or obliged to care for children can carry with it resentment and therefore risk for both the kinship carer and the child in their care. So it's important to understand this. So I think overall, what these findings suggest is that it's very important to recognise that there is no one-size-fits-all for responding to kinship care, and you really need to understand the form that kinship care takes, and therefore the particular risks, challenges and needs that may be associated with that form of care. And as well as the form of kinship care, risk is also associated with and affected by a reason for entry into kinship care, the characteristics of the child, their age, their gender, their disability, and the context that they're living in, and particularly the normality of kinship care. Right, I'm going to hand back over to Gemma now, who is going to introduce our panel, and then we'll begin the panel discussion. If you have any questions, please type them in the chat box and we can come back to them at the end of the discussion.
Thanks, Emily, for that kind of foundational understanding of how on kinship care in order to take forward our discussions. I'd like to just introduce our panelists today. So we have Blessing Mutama from FOST in Zimbabwe. We have Kathy Ashley from Family Rights Group in the UK. And we have Rajendra Meher from YCDA in India and Jonathan Hannay from ACER in Brazil. As Emily mentioned, please put your questions in the Q&A box and we'll discuss them at the end of the panel discussion. Okay, Emily, handing back over to you.
Thank you. Right, so our first question, which is for all of the panelists, is, do you have an official definition of kinship care in your context? And also, what different forms do kinship care take in your setting? And does the level of support that you offer vary by the form of kinship care? So I'm going to go first of all to you, Jonathan.
Good morning to everybody. It's a pleasure being here with this panel and with the audience. Speaking about Brazil, if there is a formal definition of kinship care, the short answer is no. However, there is a definition in law, in children's law, about who kin are. So there is a definition of the natural family, which are the parents and their descendants. And there is a definition in law of extended family. And the extended family are relations with whom a child has an existing affective relationship with. So it's quite restrictive. In infralegal documents, there is also reference to the socio-affective family, which would include friends, neighbors, godparents, and so forth, but that doesn't appear in law. Kinship care as a concept does exist in Brazil and is a practice which is very, very common, especially informally. There is a level of formal kinship care which exists in several municipalities. The reason I say that is because Brazil has a strong legal and administrative structure. And so there is no national definition of kinship care as of itself. However, and nor does kinship care appear as part of the social welfare system. However, individual municipalities have developed local laws and are developing practices in formal kinship care support. There is quite a lot of what in the UN definition would be formal kinship care, which is where extended family members have legal guardianship of children, but this does not imply in receiving any support. By being formal, it does imply that you will be able to access existing income support schemes, and you'll also be able to access full health care, education, and so forth. Informal kinship carers are often unable to access the full set of income support, and also have very much increased difficulties in interaction with health and education on behalf of their children.
Thanks so much, Jonathan. That's a really interesting answer and really interesting to hear about the variety across the country, not only within the country, of how kinship care is defined. Kathy, I'm going to hand over to you now. I know you're going to tell us in a bit more detail about the situation in the UK.
Hi, and thank you very much for inviting me. So Family Rights Group, which I'm the chief executive of, has long worked in this field of kinship care, and we run an advice line for families involved with the child welfare system. Around a third kinship carers or potential kinship carers, about 2/3 parents, and we run the all-party parliamentary group on kinship care. The question about the legal definition, and I know we'll be talking about this further, is something that we have been campaigning around. So in law at present, there is no legal definition of kinship care in England. That doesn't mean that there isn't a definition about close relative in the Children Act. There is, but that applies to grandparents, siblings, aunts and uncles by blood, or what they term half-blood, which is a particularly unpleasant terminology, but that's what's in the legislation. In terms of, there's around, according to the 2011 census, there's around 180,000 children in the United Kingdom who are being raised by a relative who isn't their parent. There is no figures around children who are being raised by a family friend. Of those, it's important to understand the profile, because we know that you are much more likely as a Black child to be raised in kinship care in England than you are as a white child. You're much more likely to be living in poverty and deprivation than the rest of the child population. There's also differences in terms of geography, and in relation to your carer being more likely to have a disability. So a range of different, so when we think about the importance of support, it's also important to recognise the features and demographics of children in kinship care. In terms of support, the answer is that there is a range of different legal arrangements the child may be under if they're living with a kinship carer, or they may be under no legal arrangement. The basic what we found is that the more likely you are to be in the care system or have been in the care system, you're more likely to be entitled to support. So for those family and friends who have stepped in early, maybe to avoid a child going into care or to avoid a crisis developing, those children and those carers are the least likely to be entitled to support. And what that raises is it's not about, principally, it's not about the child's needs or the carer's needs. It's principally about the legal arrangement as to what support follows. And I can talk more about that. In the UK, the way in which the system works is that you're either, the child is either in the care system or live it, and so the carer is a kinship foster carer if they are related or connected to the child, or the carer has got a legal order, special guardianship order or child arrangements order, which gives them parental responsibility for the child, or there is no legal order. And it is those with no legal order that I think we are most concerned about their lack of access to support. But that's a summary of the situation in the UK.
Thank you so much. That's so interesting. You raised so many interesting issues. One was about how important the demographics are, as well as the form of children in kinship care, and also this really important issue, which I think comes across in many different countries, about how support needs to be based on need rather than the form of kinship care that children are in, and that many of those that are not in formalised kinship care, which is incredibly common in the UK as elsewhere in the world, are missing out on the support that they need. Blessing, over to you now in response to that question. Tell us about the situation in Zimbabwe.
Thank you very much, Emily. Yeah, here in Zimbabwe, we managed to conduct a scoping study on kinship care around 2020, and that study actually through that study, we realized that we had a different understanding, particularly at community level, on what kinship care is. Basically, this had to do with the term, because the term was not commonly used. I think just like what other speakers have said, we usually referred to, the terms like the biological family. So at community level, you'd realize that some did not know that this is kinship care, yet that is what they were exactly practicing. And some even confused, I think, kinship care with foster. I think the earlier presenter actually alluded to that. And at stakeholder level, we had a bit of clarity, and we actually have been working with the government on reviewing our orphan care policy, which will now replace, our orphan care policy, which will now be replaced by a policy which we are going to be calling an alternative care policy for children in Zimbabwe, which is currently in its final stages. And this policy will actually give an official definition of what kinship care is. However, the understanding of the concept in the current literature that we have is that kinship care is an alternative care model or system where children in need of care are integrated into family or families that they have a relation with. And basically, when we talk about relation, we are looking at blood relations, or probably it could be a bond-based relationship, where probably it could be based on friendship. But here in Zimbabwe, we've realized that in most cases, it's blood relations, due to the fact that kinship care is deeply rooted, within our culture. And in terms of law, we do not have the term kinship care frequently being used. Our current policies, like I've said before, they actually refer to biological family. Then in the policy that I've just alluded to, the alternative care policy that is being finalized, we have tried to touch a bit on the forms of kinship care, and broadly, we have got informal and formal kinship care. Those are the two forms of care, kinship care, that we have in this country. And basically, informal kinship care, which is largely practiced in Zimbabwe, is when families make arrangements or decisions on children's placement or integration. And usually this does not go through the courts, like highlighted by the previous presenter, or involvement of any social worker. An example would be when a granny is taking care of a grandchildren, and this could be due to death. Probably the granny's child died, and the children were left in the care of the granny. Or it could be for the child to provide companionship to the granny. The granny is old and is staying alone and might need someone who would provide companionship. So a child is actually placed in that household so that they can provide that support to the granny. Then we also have uncles, sisters, and brothers taking care of their siblings' children. And this could be on a long-term or a short-term basis. But kinship care is actually proven to be on a long-term basis in most cases. For some cases, children are placed into kinship care so that they can access certain services such as education. So we have situations maybe where a relative stays near a school of choice, and the child will be asked to go and stay with that relative so that they can access, education with that school, from that school. And in terms of formal kinship care, this is when placement of a child or children into a family is done through the social services involvement or the court system. And again, this can be long-term or short-term depending on the circumstances of the child. In terms of the level of support to the carers, for us, really, in our programs, we've seen that it varies a lot depending on the vulnerability of the family. Sometimes it could be due to age. In our programs, we are working with young mothers and grannies, and you'd realize that these two groups, in terms of support, the support needs are totally different. Like with young mothers, It could be maybe they need legal arrangements, maybe to get maintenance from support for maybe the children that they are taking care of, and the children that they are relatives' children that they will be taking care of, which will be an added sort of support that they would definitely need. Then in terms of grannies, there are issues around parenting, where we are saying they need to catch up with the generational gap, which requires a lot of parental skills building. So you'd realize that the two groups already, in terms of support needs, they already differ. Sometimes in terms of the financial position of the caregiver, they might also differ, which means the kind of support that needs to be given to that household is different. Then also the state of the caregiver. Some of the caregivers might be disabled, and some of them maybe might have long-term illnesses. So you'd realize that the type of support that is needed within those circumstances will actually differ.
Thank you so much. It's so interesting hearing about how support needs vary so much by these different groups and different vulnerabilities of kinship carers. Thank you for that. And also the very varying reasons for children entering kinship care as well. Rajendra, over to you now from the Indian perspective. Can you tell us a bit more about definitions and how support needs may vary by different forms of kinship care in your context?
Yeah, thank you, Emily, for inviting me to this webinar. It's very interesting and also very important care arrangement in the present context. Tell you honestly, in Indian context, we do not have any official definition of kinship care in any of our law regulating child protection system. So we do not have any official definition. We go by the global understanding or the global standard, what is written in even CRC, and that is basically our reference documents. So as for the current practice, any child who is looked after by his or her close relatives in absence of parental care is considered as the kinship care. So this is the standard global practice we refer in our operations. So that is basically the current scenario. Coming back to the type of care, see, this is considered as one of the very informal care practice in Indian context. And this also happens by default. So there is no any court order is needed. So in case of anything happens, so the family or the close relatives, they take care of the children. So that basically happens by default. So don't need any kind of court approval to look after the children, those who are not living with their parental care. But however, there are a few mechanisms are also in place to ensure the kinship care, like which you can also consider as the part of kinship care or close to kinship care. Like one is a couple of things are family driven. Like as I told you, it's very informal in nature and it does not need any kind of court approval. So in case of any emergency comes or children lost their parents or any difficulties happens in the home, so the grandparents or the uncle or aunt or close relatives, they come forward and then take care of the children. It's basically a family driven. The adult member of the family or the caste head of the family or in the community, they basically take care of these children, need to be placed in their close relatives. They don't allow children to go out. So the first option is basically given to the close relatives. It's culturally rooted in our practice. And then coming back to the second practice is basically there are also a couple of personal laws. Like, India is basically a very diverse country. We have the Hindu, Muslim, Christians. So there are also a couple of personal laws. Like, take the example, we have the guardianship under Muslim law. There is also a Muslim law exists, which also ensure the children needs to be taken care of by their close relatives. We also have the Hindu Adoption and Muslim Maintenance Act. Like India is a very dominant Hindu dominant country, And we have a very specific law called Hindu Adoption and Maintenance Act, which is also guaranteed children to be taken care of by their Hindu religion itself. It cannot be go to the other religions. It's basically religion specific. So these are also laws available to ensure the children are also taken care of by their relatives in case of any emergency comes. Apart from these, there are also a couple of government driven, like we have also a Guardians and Wards Act. So that is also prevails in our country, where a district authority, particularly the collector, who is the head of the district geographical area, is declared by the court to be guaranteed to act as a guardian of the person or the property or both of the minor. So in case of anything happens, then the collector is being declared as the guardian of the minor by the court. So this is also ensure some amount of practices where the children will be also taken care of by the their close relatives and the authorities. So these are the current practice we have. And coming back to the support system, we do not have any structured support system in any of our schemes available, which is not there. So what is available is basically depend on the need. In case of any needs comes, like many times the trauma counseling is a bigger need, so that is there. So we have a mechanism to support children on counseling, providing support. We have also some amount of legal aid support system is also available in our country, where if any kind of legal aid support is needed, then there is also an authority available at various levels to provide legal aid support. In case of counseling, there is also possibility of providing counseling support. And there is also a lot of social security schemes are also available, where the adult member will also be provided various social security and schemes to take the build the capacity of the families. Recently, apart from all these things, we have a sponsorship program available under the current law, where these kind of children will be also covered as a part of our preventive approach. So we identify the families where these kind of children are there, and we also provide them support to avoid further unnecessary separation. So these are a couple of support systems are available in our system currently. But as long as official things are concerned, we do not have any declared official definition of the kinship care. We go by the global standards and global understanding ruling the law of the family-based care system in the country. Yeah, thank you very much.
Thank you so much. It's so interesting to hear about the particular religious norms and laws that might shape kinship care. Thank you so much. That's really fascinating. So I'm just going to move on to the second question. And this question is for Kathy. I know that the family rights groups in the UK are advocating for there to be a legal definition of kinship care in the UK. Can you tell us a bit more about why you're calling for this, and also some of the dilemmas that you faced in trying to develop this definition? So over to you, Kathy.
Just unmuting. Can you see can I just get an indication if you can see the screen? Okay.
Yeah, we can see it beautifully. So, thank you.
A key concern of ours is that too often the uniqueness of kinship care isn't understood or appreciated by our public agencies and the child welfare system, the family justice system, and instead children living in kinship care arrangements, whatever type of kinship care arrangement, are forced into a system that's not designed for them. And that often means, and I thought it was interesting, Emily, when you were describing some of the sort of risks, if you like, of being in the system or not in the system, is that kinship carers often report that they spend a lot of time having to battle with systems to be accepted, that they're forced to undergo all sorts of assessments or training or sort of overcome hurdles that aren't designed for kinship carers, that were designed for stranger foster carers or even adopters. and that the very nuance and the benefits of kinship care, that relationship between the child and their carer, is often not understood. So we have been looking at how can you design a system that actually is tailored to kinship care, as opposed to making kinship care and families fit a system designed for effectively adoption and fostering. And part of that is to have a common definition written into law so that all agencies understand what kinship care is, and that it doesn't matter whether the kinship care is in an informal arrangement or under a legal order or in foster care, that basically all agencies have a common understanding of what being a kinship carer is. So you're not ending up with kinship carers who take the child to the hospital having to continually explain themselves, or to a teacher, or to the benefits agencies, whoever it may be. It's also, kinship care is still, and most people who are, you know, my mum raised for a while my nephew, and she didn't see the term kinship carer. She just saw herself as a grandma who's looking after her grandson. So there's little at the moment sort of common knowledge, if you like, of the term kinship carer, but there is something about the importance of raising awareness about children living within their family relationships, and that's particularly important in our UK context, because there's a record number of children in care in the UK, and the care system is in crisis. And some of those children with the right support could be living with their family members. So we need to raise awareness of kinship care. We need to raise awareness about the support needs of kinship care and its uniqueness and its benefit to children if a child can't live with their parents. So part of writing it in law is to provide clarity across public agencies. It's to raise awareness, and it's also to do something else. And that is about basically having a system where if you are a kinship carer, it doesn't matter what type of kinship carer, that would passport you into some automatic minimum levels of support entitlement. And again, I noticed, Emily, when you were talking, and indeed when listeners, that there is, children are in all sorts of circumstances. For example, as described about a parent dying, it may have been due to the pandemic, it may be for other reasons. There's something about what are those children's need, regardless of legal arrangement. And this is, you know, there is a reason that they're living with this relative. It may be tragedy, it may be trauma, it may be temporary, it may be permanent, but it's about thinking, what is the minimum level of support those children need, regardless of legal arrangement? It doesn't mean that if a child's in the care system that they shouldn't continue to get the entitlements that they've got now, but it's about thinking, what should every child in kinship care? It may be around trauma counselling, maybe the carer having access to pre-legal advice to be able to navigate the system. It may be therapeutic support, it may be financial assistance, it may be some settling period while the child goes to live with, but it's about working through what's the absolute minimum level of support, and this being a way of passporting through. So that's our campaign. We launched the campaign. For it's not easy to write the definition, because when you're writing a definition for law, you can't use terminology which is already in law and means something else. So we've got to create that definition. We're going to publish next month our draft definition that we will then consult on, encourage government to consult on. We've already engaged kinship carers in devising that draft, but that's the next step of the campaign. So we launched the campaign called Time to Define in April, and we've already got the backing of the opposition in government, the Labour Party. We've got the backing of a government commission review into children's social care, and we've got a number of other key sort of decision makers saying, yeah, we recognise the importance of this.
Fantastic, thank you so much. That was really fascinating to hear that to understand what's happening in the UK. And I'm just so interested about this, the fact that this having a clear definition of kinship care and having people actually understand what it is and what it isn't is so important for kind of raising the profile of kinship care and a kind of precursor for defining what types of support kinship carers might require and people to understanding how they can provide that support. I'd urge everyone to have a look as well at the all-party parliamentary group, which we haven't had time to get into, but I think it's a really fascinating example from one country about how you've managed to promote kinship care and really raise it up the agenda in the UK through the parliamentary system. So I'd urge people to take a look at that as well. You can Google it. Okay.
Sorry.
Yeah,
Emily,
so go ahead. Yeah.
Very quickly.
Yeah, sure. Of course.
It's just a recognition from kinship carers that there's some things which, like, for example, legal advice or representation, that they would not be facing those costs if they weren't a kinship carer. There are some things which actually need acknowledging, that people, 50% of kinship carers in England have to give up their job at the moment when taking on the child. That's not, there are some protections for adopters, there's some protectors birth parent, but for kinship carers there isn't. So it's not just about sort of treating kinship carers as a special case, it's also about recognizing that at the moment there's actually almost, you're penalized financially and in other ways when you do right by children in your family.
Yeah, I remember reading an account from the chair of the all-party parliamentary group, I think, about how when you receive a child in kinship care in the UK, you just have to take care of them straight away. You don't get any time off work, you don't get any time to adjust. You're just expected to kind of pick that up in a way that an adoptive parent wouldn't be expected to do. So yeah, it's a really interesting example. Okay, I'm going to move on to the next question, and this one's for Jonathan. So could you tell us a bit about the thinking about the experiences, the support need, the challenges, etc., how kinship care is different to or similar to foster care?
Thank you, Emily. And I think there's a question here that before I can fully answer, because I think in many different countries, they're very different descriptions and categorizations of foster care, which in many cases are mixed in with kinship care. So in many countries, you will hear terms foster care, kinship foster care, and often not a great deal of clarity. In the Brazilian context, I'd like to make this very clear that in Brazil, there's a very strict definition of who can be a foster parent. They cannot be a relation of any kind, neither can they be on the adoption list. Brazil has a single adoption list that anybody interested in adopting a child signs up to and gets evaluated, gets trained locally, but according to national rules and a national register. So if you're on an adoption register, you are not allowed to be a foster parent. So in Brazil, foster care is non-relation care. Kinship care, as I stated earlier, in law is a relation who are not your parents and with whom the child has a previous relationship. However, in practice, this is often extended to family and friends, as it would be said in the English context. I would start by, within this idea, I would start by saying that there is a very key difference between working with kinship carers and working with foster families, which is when you're working with kinship carers, you are working with the child's own family. You're not, and there is no time perspective. So a child who is in kinship care in general is not in a placement for a given amount of time, especially when it's an informal placement. Whereas children in foster care are always there, or in our experience in Brazil at least, and I believe England and many other countries, foster care is only used as part of the formal social welfare system, where you have a judicial order determining it, and it will often be determined for a certain amount of time. In the Brazilian context, a foster family is always temporary. They are prohibited from adopting, for instance, even if they've established a long-term relationship with a child, and are always looking, the social welfare system is always looking either for the child to be reintegrated to their own family, be it their parents or extended family, or placed in adoption. So going back to what is distinctive about kinship care, one is the child is within its own family context, their own family history, and therefore what I would say is a very important part of working with kinship carers is to have a clear understanding of the intergenerational patterns within that family history, the different cultural aspects. So in different peoples, Brazil has many different indigenous groups. It has travelers, it has people in quilombos, which are communities formed hundreds of years, 100 or hundreds of years ago from enslaved people who had escaped, all with their own definitions of family, their own definitions of belonging. And so within kinship care as a whole, I think it's very important also that one does not come towards supporting kinship care without taking in the broader religious, social, and cultural contexts of that extended family, of who is kin within that space. Again, I was asked to talk about difference and different approaches between foster care and extended family or kinship care. And I would also suggest that one has to have a different approach between working with parents and their children and kinship carers with their children, because the focus on working with parents and their children is to repair, to modify an internal family dynamic to maintain children being safely brought up by their parents. And the focus is on the parents. With the extended family kinship care, one is having to work with the kinship carers, often grandparents or aunts or even siblings, who they themselves have to manage the relationship between the birth parents of the child who is in their care and their own family relationship with their children or their siblings or whatever. And so I think these are all questions that make working in kinship care very different from working foster care. Things that they have in common, I would say, is that except where you're talking about informal family arrangements. But when we're talking, I would say, when we're talking about children who are in kinship care because they have been removed from their parents, because their parents have been violating their rights, there has been violence or whatever, and it doesn't necessarily mean a court order, because many communities and families move children away from abusive parents into another part of the family. But these children, in common with children who are in foster care systems, will have experienced trauma, will have experienced forced breaking of bonds with their parents, and therefore they all need specific support, which is common to the two cohorts, I would say.
Thank you. Thanks so much, Jonathan. And you started to touch on the area that we're going to be discussing in the next and final question. And this goes to Blessing and Rajendra. If you could just keep your answers to just a couple of minutes each, because I can see we've got tons of questions coming in from the participants. So we want to allow enough time to answer at least some of those. Could you tell us how support needs of vulnerable parents are different from the support needs of kinship carers? Maybe, yeah, you go first, Rajendra. Please go ahead. Yeah, fantastic.
It is quite difficult to give you a very structured answer in looking into the Indian context, because you know, India is a very vast country with a diverse cultural practices and all these things. But having said that, I can categorize a couple of support system. One of the biggest need is basically provide counseling support for the children, those who are coming to the kinship care, because they change everything. And suddenly everything is changed. So they need a lot of support, external support, counseling, care. So this is one category where we need support for the children. Another category is basically to provide family strengthening support, because most of the children are coming to the families, coming to the kinship care, are extremely poor, or the poor category, are very vulnerable. They have already loaded with their own children, own biological children, and this is an extra burden for them. So a structured family strengthening support is needed to build the family capacity, family economy, so that they earn more money and provide support needed to the children. So they can send the children to the school and other support system. They can do that. Apart from this, there are a couple of community safety needs are also there. Like if the government is not there, or any kind of external support is not there, then also we have a culture of community safety nets. Like in each and every villages, we have a support system exists to provide support to the vulnerable families. They can take the loan, they can borrow money, they can borrow kind of support. So like we have a self-help group approach exists in our country. We have a lot of practices, traditional practices, like we have a grain bank. So these are a lot of family support system, or the community safety net systems are exist in our country, which we need to link the families to these families. There are also a couple of very innovative interventions are there. Like one intervention I have already told, like YCDA, we are practicing the family support group. This is a group, basically we form, nurture to build the solidarity, provide support, mutual understanding, helping the family to go to the government, get support from the government scheme. So this is also some of the things we can help the families to avail from this. On top of all these things, what is needed is basically consider kinship care is one of the care arrangement by Indian law. This is something we are trying to do, that once this is considered one of the family, alternative family care, then I think most of the problem will also get solved. They will entitled to get all the support needed for this family based care, which other supports are getting, like in case of foster care or any other care arrangement, the families are being provided financial support, regularly cash transfer, other supports are also there. So if the kinship care is also considered one of the care arrangement, then I think most of the children living in the kinship care, which is the number is very high. I don't have any exact number, but maybe more than 85–90% children are there in the kinship care practices, which they will cover under this law. So that is also needed for us. So these are a couple of support systems we can ensure for the betterment of the children, those who are placed in kinship care arrangements.
Thank you so much. And over to you, Blessing, with the same question. If you can just tell us about how the support needs of the kinship carers are different from the support needs of the parents that you might be working with.
Right. Thanks, Emily. For me, really, like what Rajendra said, similarities may exist, but with differences. For an example, a household headed by a sick caregiver in the household that is being headed by a sick granny, or a sick uncle. You'd find that in both situations, the first household headed by a sick caregiver is probably could be the parent, and the second household being headed by a sick granny could be a kinship care household. In both situations, you need support like education assistance, for the children, economic strengthening assistance for the families can actually apply in both situations. However, when we are talking about kinship care, one thing that we've realized is that kinship care demands more. For an example, Agenda was just talking about the number of children, that are supported in kinship care. Usually you'd realize that more children are taken care of in kinship care households, which results in competing needs for the resources, and hence you realize that the resources will become scarce. And then in some cases, you cannot only support, the child or the children, that were placed within that household. Like for an example, let's say you are doing food distribution programs. You cannot provide food only for the 2-3 children that were placed within that household. You then really need to ensure that the whole household is fed, is supported with food. And we have seen situations where there was victimization of the children placed in these households because they'll be getting some form of direct support, and in the end, they end up looking better, than the children that belong to that household. Then also issues around parenting, differ as you are taking care of children who are not your biological children. We've had situations again where children say, they treat me this way because, they are not my mother. So there are a lot of things that we need to address. It could be issues around dealing with loss and grief. When we are talking about children or families in kinship care, we really need to work on these areas. And also lastly, the reason why children enter into kinship care also matter. You find some children, they enter into kinship care because of abuse, and in the end, there is specific, support that needs to be provided to those children and their families. Yeah.
Thank you so much. Really interesting answers. I'm going to hand over to Gemma now, because I can see we've got a long stream of answers coming in via the chat box and the Q&A section. So I'm going to give Gemma the difficult task of working through those and asking the panelists to respond to some of those questions. Please go ahead, Gemma.
Brilliant. Well, thank you to all of you for sharing your insights and your experiences on kinship care, the need to define it, and the support needs as well. So in terms of the questions, I think some of them have already been answered in the chat, which is great. So there was a question that originally came in from Joseph in Uganda around how do you regard close family friends who take on children that belong to their friends? Would that still be kinship or foster care? Now, Blessing, I think you initially went back to him, but I don't know if you wanted to expand on that a little bit further, because I know it's something that's been touched on as part of this.
Yes, thanks. So thanks. That was Joseph, if I'm not mistaken. Yeah, for us, that is regarded as kinship care, as long as the care arrangements are made without the involvement of a social worker or the court system. That becomes informal. That's informal kinship care.
And did any of the other panelists have a different response to that question? Or?
No, in Brazil, it would be considered exactly the same way as Blessing described.
In the UK, it is as I say, there's no definition of kinship care. It would be seen as kinship, but the legal arrangement varies. So you can't take on the care of a friend's child without either having a legal order or being assessed as a foster care, or you would be what's described as a private foster carer, and that means that the local authority would have some responsibilities to assess and monitor you, unless somebody died and you were the guardian that was in their will. But basically, there's a variety of different arrangements, but you can't do it without some either court intervention or legal intervention or local authority intervention.
Rajendra, do you wanted to respond to that?
Yeah, I think in Indian context, the kinship care is considered as the very informal care. We do not have any kind of formal kinship care arrangement. It's because the care arrangement is not been accepted, not been considered as one of the family-based care. So everything is happening informally. So there is no any formal kinship care arrangements.
Thanks everyone. Joseph, I hope that answered your question and gave you a variety of insights into different contexts. There's a question here as well around, do people that provide kinship care support receive payment in different countries? So I know this has been touched on a little bit already, but did anyone want to expand on that in terms of their experience in their context?
Sure.
I tell you, in India, I think we also have a program called sponsorship program, where if these kind of children are coming under the court purview, no matter whether they are coming under the kinship care or the foster care or any care arrangement, if the children are coming under this purview, then we have a provision of providing case transfer to the families. It's a case transfer for a period of 3 to 5 years, would provide some amount of case to look after their family needs. So this is will exist in our system, but it is not for the kinship care only. So this is basically for the whole children who is not living with their parents or biological parents. They can avail this kind of support. This is available in our context. Yeah.
Thanks, Rajendra.
Yeah.
Blessing, could you?
Yeah, maybe just to say for us, more than 90% of orphaned and vulnerable children in Zimbabwe, they're actually staying in kinship care, informal kinship care. So I think for the government to be able to pay out grants to those people is literally impossible. So you'd realize that we do not pay out any grants to children who are in informal kinship care. Like what Agenda said, I think for those that go through the court system and probably are being taken care of as foster in the foster homes, they're the ones that are getting grants. But for kinship care, no grants yet.
Thanks, Blessing. Kathy.
Okay, so it's a nightmare to navigate and to determine whether you are entitled to financial help, or you may qualify for financial help, or you don't receive financial help. As a base, you should be able to get, for example, child benefit, which a parent would be able to otherwise get. But in terms of additional financial support, it depends, again, whether the child is formally looked after in the care system and you're a kinship foster carer, then you are entitled to financial help. If you've got a legal order, so you've got a special guardianship or child arrangement order for the child, then you may be able to get some financial assistance. But part of it will depend whether the child was formally in the care system beforehand or not. And it varies by local authority. And it's, I mean, we're suffering in the UK from austerity, further cuts to, and the cost of living crisis, which I recognise is global rather than just to the UK. But the impact of that is that what financial help may have been available is actually being squeezed, and instead kinship carers end up having to financially pick up the pieces without state help often. So there is a big campaign going on in the UK to try and persuade the government that they should be paying a financial allowance to kinship carers, particularly if the state is involved in some way. But we await how the government will respond to that recommendation and that campaign. It's part of the reason why we have got things like the all-party parliamentary group and why we want to raise awareness. It's actually to make this into an issue that the government can't ignore. So I'll leave it there.
Thanks, Kathy, for exploring some of the complexities around this. Jonathan.
Yes, so specific grants for kinship care in Brazil they do exist. So they exist in municipalities which have established laws which enable the setting up of formal kinship care support programs. And within the support, you will have technical support by social workers, psychologists, and so forth. And you will usually have a grant. So in the municipality of Diadema, which is a city of 400,000 in the Sao Paulo metropolitan region, which is where my organization established the kinship care program in 2009, there was established half minimum wage as an initial grant, and then the equivalent of a food basket monthly afterwards. And each municipality establishes their own values. So you have some much lower than that, and you have some municipalities which are much higher than that. So I would say on a country level, we have no consensus and a fair amount of discussion about the formal financial support of families.
Thanks, Jonathan. We've got a question here from Andy. So 3 million children in kinship care in Thailand. Most rely on money being sent back by parents who have migrated for work. The death of a parent increases the risks of these children being relinquished to private institutional care, and the death of both parents makes this risk very high in some areas where unregulated institutional care is readily available. Are these risks seen elsewhere in any of your contexts? Jonathan?
Yes, I would say, yes, there are these risks in Brazil. The context within Brazil, which is similar, is not international migration so much, though that does exist, but national migration. And the risks in our context are the fact that if it's informal kinship care and the child has a special health need, which needs surgery or something similar, then a parent has to move from wherever they are in order to come and sign the paperwork. So the informality of kinship care arrangements, especially around migration, does put the children at a greater risk. And of course, if parents die, then they are also in limbo, because you need all of the paperwork on the death in order to get anywhere.
Do others experience this, where there's a greater risk for children where parents have died rather than just migrated? Blessing? Blessing, sorry, were you going to respond to that?
Yes, thanks, Gemma. Yeah, I think we do have almost similar situations, like for parents who have migrated to the UK for greener pastures. And if anything happens to those parents, I think the children will suffer the consequences. And now this goes back to the reasons, why children, are accepted in kinship care, which is something that we have tried to investigate, when we were carrying out the scoping study, and we've realized that some families, they actually take children into kinship care because they know that there will be a benefit. Because if the parents are sending something from the UK to Zimbabwe, then it means the whole family or the caregivers will also be benefiting. So in the event that that money is no longer coming, the children are the ones that will then start, suffering. Yeah.
Thanks, Blessing. Just moving on to the next question here from Iftikhar in Bangladesh. So is there any separate policy or procedures in any of your contexts for kinship care of children with disabilities? Because it'd be great to have some expertise or experience of care for children with disabilities. I think Emily and I agree on that. The more of these experiences we can access and understand, would be great.
I just maybe before the panelists come in, I'll just come in quickly to say we've been doing this quite comprehensive literature review, and we found nothing on the particular needs or particularly good practice for supporting children with disabilities. So we'd really welcome examples. I'm sure we recognise it an important area, but it's been hard to find anything.
So if that is something that panelists can respond to, yeah, Kathy, please.
So the answer is no. There is, there is family and friends statutory guidance. Statutory guidance is basically guidance the government has issued that local authorities, the councils, should follow unless they can give good reason not to. And that family and friends care guidance is probably the nearest you've got in England to a sort of minimum expectation on local authorities as what they should do in supporting kinship care. So family and friends, term family and friends and kinship care are interchangeable in that regard. But it doesn't specifically address the needs of disabled children. And our research has shown that disabled children are more likely to be living in a kinship care arrangement than in the wider population. So it's an area, and we know they're more likely to have special educational needs and be excluded from school. So it's an area that does need far more attention, and we'd be really interested in any developments in other countries that we could learn from. But it's not an area that's had the attention it needs in the UK.
Yeah, I mean, as Emily mentioned, that's been shown in our experiences of trying to understand it better as well. Jonathan, sorry, did you have something to add?
Yes, in our experience as an organisation over 10 years delivering a programme, we had a significant number of children with disabilities and a significant number of caregivers, including one who was bedridden and still managed to bring up 4 grandchildren successfully. And what I would say is that from what we understand through practice is the families don't see the disability as something extraordinary, but just one extra need that needs to be looked after. And what it meant for us as an organization, usually, because other services were not doing what they should be doing, like health and education, it meant that the technical support that we give to the families, which normally would end after 2.5 years, so a family stays for 2.5 years and then graduates, but with families with children with disabilities or caregivers with disabilities, often we would extend the technical and financial support for up to 5 years and try and put other things in place.
Thanks, Jonathan. I think what I would say is if any of those attending today's event do have some experience or resources that they could share with us around this, it's definitely an area that we're looking to better understand and better represent as well. So it's one of the gaps that we've identified in the research that we've been doing and developing the guidance. So please do reach out if you do, if you can add to the experiences that we've heard today to kind of expand our understanding and insight into that. I've got another question here from Emma from Kinship Care Ireland. We have some confusion around informal kinship care here in Ireland, where children are placed in the care of relatives by social workers in circumstances where they would otherwise be placed in the formal care system. Yet this is described as private family arrangement. It is a kind of doublespeak which leaves the kinship family without any status or support at all. Does anyone else have these types of challenges? So any panelists who would like to come forward on that one?
No.
Yeah, Kathy?
Well, sorry, I just was going to say that there have been legal judgments in England, which we have used to make sure that local authorities are aware of, which is that if a social worker places the child, then unless the kinship carer has made an informed decision otherwise, then that child, it should be treated as a foster care placement. So basically the state has at that point a responsibility in terms of assessment and support. Now, just because there are legal judgments, very now repeated established legal judgments to that effect, doesn't mean that that isn't that sometimes that's not what's happening. So we see on our advice line, or we hear on our advice line, kinship carers saying it was a police officer who dropped off, or a social worker got a taxi to drop the child off, and then are saying it's not our responsibility. And we have effectively challenged that. And there's local ombudsman in England as well, who has issued a number of judgments saying that local authorities must comply with this, but it doesn't mean it's not a fraught area, and it doesn't mean that continually kinship carers are told it's a private arrangement, but legally it's not a private arrangement. And it's one of the reasons we need to raise awareness around this.
In Brazil, we have a very similar thing that happens. There's a particular construct called the Tutelary Council, which is not part of the judiciary, but it is a community level, formal public body that exists to protect the rights of children and adolescents. And they are very frequently involved in placing a child with kin in an extended family. They will give a document saying that the family is now responsible for the child, but in law, this document is not recognized by anybody. And so the families, often the extended family, believes that they have all the legal paperwork and that will help them access whatever, or even be legally recognized as guardians, but they're not. So I'd say that's a parallel that exists in Brazil and is extremely common.
Blessing or Rajendra, did you have anything to add to that question, or I'll move on to?
No comment. Yeah.
Okay. I've got a question here from Scarlett. Could you please discuss, as you've already started to in the initial presentations, kinship care by non-relative caregivers and the legal framework for that arrangement, so teachers, friends and neighbours, as well as what support are available in the formal context. The follow-up question is also, what work does your organisation do to support the sometimes complex and fraught relationships between parents and the kinship caregivers whilst children are in formal kinship care?
Yeah, maybe briefly,
Yeah.
for the first question, what we are doing as a country, like I've said, that we have not drafted a new policy called the Alternative Care Policy for Children in Zimbabwe. And once that is endorsed by the government, we then want to come up with guidelines that will then determine, what kind of support should be offered, within kinship care. Even, you're talking about, children who are disabled, or maybe who are living in the household where there is a parent who is disabled, that those guidelines should specify what kind of support then should be provided. Then maybe in terms of the second question, As an organization, we are running support groups for caregivers. So we do have support groups for young mothers, where we talk about issues around parenting, and we do a lot of activities, income generating activities within those groups, so that economically they are strengthened. As well, we do have support groups for grandmothers, where they talk about issues that affect them, issues to do with parenting. Yeah, maybe in a nutshell, because of time, I think, yeah, I'll just leave it there.
Thanks, Blessing. Did any others want to add quickly to that?
I've just put a good document on it in the chat box. If you're interested in reading more, you can see it there.
Thanks, Emily.
So if it's, oh, sorry, Jonathan, you could.
Sorry, just quickly on the second question about supporting the complex fraught. In our experience, it's greatly facilitated to support the caregiver as long as they have a guardianship document. If they do not have formal guardianship, it really is unbelievably difficult. So having a formal guardianship means that the support worker can strengthen the caregiver to establish boundaries supported by a legal document. Without the legal document, it really does. It's case family by family and the support you can offer.
Thanks, Jonathan.
I was just going to add, in relation to the question about teachers and others who've known the child, then that's exactly the same as with a family friend. It's all in. So the answer is really in relation to relationships and how to manage those. What we do particularly promote is the use of family group conferences, as well as mediation, but particularly family group conferences as a way of planning and supporting children to be appropriately raised within their family, but thinking through some of the questions around family dynamics and how that can be done in a way that's right for the child, and also thinking about revisiting as a child gets older what their needs are and what the circumstances may change. So it's not a sort of fixed in stone. But it is an area that clearly is often fraught with difficulties.
Thanks, Kathy. I'm conscious of time, so I think we're going to have to draw it to a close, unfortunately. I think for those questions that we weren't able to answer in the time today, what we'll do is we'll post them on the Changemakers platform, and hopefully the panelists can continue to answer them there, and to add, and not just the panelists, open it up to a wider forum as well, as if those others attending have had some interesting experiences or insights that might also help to kind of broaden our understanding of these different challenges and complexities around supporting kinship care. That would be brilliant. What I just wanted to take this quick moment to say is thank you so much to Emily and the panelists that have joined us today, Jonathan, Kathy, Rajendra and Blessing. It's been great to hear from all of you and from such diverse contexts. I also wanted to take this opportunity to remind you all that this is the beginning of a learning series. So we're going to have more online events on a monthly basis, with the exception of December. But so the next one will be taking place in January, and we'll be looking at policies and guidance on kinship care and shaping the social workforce to support kinship care. And that's due to be on Wednesday, the 25th of January. So I hope that you can all continue to follow this learning series going forward. And I will just share in the chat as well a final link to Changemakers, where you can learn more about the full series and the following events that will carry on after that, going forward all the way to June 2023. Thank you again to everybody, and I hope that we can carry on with the conversations on Changemakers. And if you can all just complete the closing poll that should have popped up on your screen, that would be great, and give us a little bit of guidance in terms of the types of information and learning that would be beneficial to you all going forward from here. Thank you again.